present with a physical health problem, we get a certain kind of care. And I'm thinking about a woman who's from Perth. She told me the story. She presented with a small breast lump to a doctor. The doors of the health system just swung open to receive her. She was fast-tracked. She had simple operation. She woke up, as she put it, in a room full of flowers, surrounded by her friends and family. And it was a very positive experience. She recovered very well. 6 months later, she had a recurrence of a depressive illness and had tremendous difficulty getting access to care. When she did get access, she found herself in much bleaker surroundings with many fewer friends and family involved. And this is the same woman in the same healthcare system in the same city. So this is why I use the term apartheid. It's sort of an apartheid depending on what kind of problem you've got. Okay. So today, many thousands of Australians with severe mental illnesses are in our jails because there are no other options, and they have not received the mental health care that they needed when they needed it. Today, mental health services are given the impossible task of addressing 14% of Australia's health burden with just 6% of the health budget. And if you think for a moment that mental ill health affects people in the prime of life, it's not people over 50, it's the teenagers, the young adults, and people up to the age of 44. They carry the most burden. So in that age group, it's 36% of the health need, receiving 6% of the health budget. So it's no wonder that we've got a huge problem. Tonight, thousands of Australians, mostly young Australians with mental illnesses, will sleep outside because we don't have an adequate number or range of accommodation services to give them shelter. These are not just numbers. They represent the pain and anguish of real people and real families. I've heard directly from hundreds of these Australians this year. It's a heart-rending Australian story, which could be one day your own story, if it isn't already. And that has to change. So we know a 21st century approach to mental health care must fix these problems and must provide real benefits to all Australians. So what would a 21st century model do? The reason I've been labouring this 21st century point is because we actually are 10 years into the 21st century. And, I think back to when I first started training in psychiatry at Newcastle Psych Centre. And that was a 19th century model. Morris said the Newcastle Psych Centre model was a 19th century model of care. It was the asylum model, constructed in the age of steam. And here we were in the late 20th century still trying to work with that. And in the last 20 years or so, we have made some half-baked attempt to modernise it. And I know in Newcastle you've got new facilities now, and they've been developed. But this is a very half-baked approach. What we've tried to do is say, okay, that Dickensian model wasn't right, so we're just going to lump it all into the mainstream health system and hope for the best. Well, we haven't funded it properly, and we haven't designed it properly, because the mental health system has to tackle quite a different pattern and age group of illness, and I'll elaborate on that a little bit further. So, a 21st century model means that Australians understand what it is to be mentally healthy and are able to recognise, just as they do for heart disease and cancer, the earliest signs of mental ill health. Currently, many people don't recognise when their mental health is failing and don't seek help. So of those several million Australians that don't get help, many of them don't even recognise that they need that kind of help. The 21st century approach to mental health means that the response from family, friends and workmates and health professionals is supportive and skillful. Everyone is equipped with the knowledge and skills to respond in a helpful way. The same as when someone sprains their ankle, has an asthma attack, faints, or develops chest pain. That's first aid. Today we're uncertain about how to respond to distress and disturbance,